Hello, everyone, and welcome everyone to today's Excellence Chat. I'm delighted to be here. My name is Karen Jackson. I'm Senior Advisor at Excellence Canada, and I'm really excited to be speaking to you today on this timely topic, how to manage and respond to workplace mental health challenges in the time of COVID-19. Really a challenge for all organizations that we are facing right now. Next slide. Yes, so I'm delighted to be co-hosting this Excellence Chat with my guest, Donna Marshall. Donna is the CEO and co-founder of Workright Incorporated, and she also has her clinical mental health. She's a clinical mental health professional and specializes in workplace mental health and psychological safety in the workplace. So Excellence Canada has a partnership with Workright and in the offerings of their exemplary mental health programs, the master's program in mental health and psychological safety and the diversity and sensitivity training awareness program, as well as a COVID kit care package, care learning package for your employees. And you'll hear more about that from Donna in a couple of minutes. So together, we're really hoping to provide you with some insights and some knowledge that will really help you in your own mental health journey, workplace mental health journey for your own organization. Just a couple of notes. We're going to have question and answer, so you can use the question and answer box to answer any questions that you may have at the end of the session. And because this is going into Mental Health Awareness Week next week, and to build awareness around mental health, Excellence Canada is going to be giving out our Workplace Mental Health Essentials assessment package for free. So you will receive a link to that following this session. So we all know that COVID has really had a huge impact and brought fresh challenges to all workplaces worldwide. And this new reality really requires a real disciplined approach to managing workplace mental health and requiring new ways to learn knowledge, information, and really in how we can support our employees in dealing with the constant change and the uncertainty, which for sure we know going forward is going to continue. Next slide, please. Thank you, and that just gives a little overview of the Workright programs. So our agenda today, we have a full hour for you, and with time for question and answers, of course. So I'm going to start with a little bit about why the urgency right now, given the pandemic, and then talk about some workplace solutions. And really, that will be part one will be on standards and frameworks that really help provide that disciplined approach and frameworks for success. And then part two will be the critical knowledge and skills and information that you need in order to support employees and help them cope with the changes in the workplace right now. Very important solutions for going forward. So there'll also be resources will be listed on the web on the presentation towards the end, and we will have time for question and answers, as I said, towards the end. So why workplace mental health now? And next slide. And many of you have heard this, but I just think this information is so important. We need to remind each other of this. So every week, 500,000 Canadians miss work each week due to mental illness. And the economic burden to the Canadian economy is 51 billion, and that's expected to go up to 2.5 trillion in the next 20 years by 2041. These stats were calculated before or predicted before the onslaught of the pandemic. And of course, we all know that mental health is the number one concern for many workplaces and for many people around the world. So those costs will only go up. And by the age of 40, half of Canadians will have had a mental illness. So many of us will experience, as well as many of our family and friends. Next slide, please. So why is this important to the workplace? Well, as many of you know, workplaces have been focusing on mental health in the workplace for the last 10 years and really looking at those costs and issues associated with mental health. The pandemic has brought it to the forefront even more so. But when we talk about some of the costs, we're looking at the financial costs in terms of disability costs. So 70% of disability costs and 30% of disability claims are related to mental health. So it's really important you look at your own data in your organization. What is it saying? And what are those costs that are associated with your mental health claims and disability? Other financial concerns can be the illness, injury, and insurance claims, absenteeism, and regulatory and legal issues are there issues around the employer's due diligence and heightened awareness and concerns around the liability for mental health in the workplace and paying more attention to that and the due diligence around that. And of course, the reputational concerns are to do with the your reputation, your public image, your ability to recruit and retain employees. So with the pandemic layered on top of this, it just adds more challenges. And more than 60% of employees with mental illness and addiction issues also report being disadvantaged at work due to their conditions. So this speaks to the stigma that employees we've come a long ways, but there's still not, there's a concern about or fear of speaking up and sharing their issues and knowing where the resources are and knowing what to do. Next slide, please. So now this brings us to the workplace solutions. Next slide. So why is it that organizations struggle to manage psychological health and safety in the workplace? Why is that? So one of the reasons is the organizations do not understand the issues. So what are those psychological health and safety risk factors in the organization? What are they and how do we find out and assess for them? They also don't know what actions to take or what strategies, what interventions, and there's so much out there. Where do I begin? What do I do first? And how do I do this right? And they also don't know just how to manage it as a system in the workplace and integrate it with the work that's already going on. And that really brings us to the standards and frameworks and the importance of following a standard and framework. The national standard, most of you are probably aware of, is the National Standard for Psychological Health and Safety in the Workplace. And it came out in 2013, voluntary standard. And just to remind you what the purpose of the standard was, it's really built on that vision that a psychologically healthy and safe workplace or a mentally healthy workplace is really there to actively prevent harm to psychological health. So identifying those risks, assessing them and prioritizing and then taking action to prevent harm. And then promoting psychological well-being, which is through training and through events and programs and to reduce stigma and build awareness around mental health in the workplace. And this standard is all grounded in the principle of shared responsibility. So it's not all the employer's responsibility. It really is a shared responsibility with employees and employers. And that's very important as you're going forward in this work and you're building that understanding with your own employees. Next slide, please. So this brings us into the framework at Excellence Canada, the Mental Health at Work framework. And our program really serves as a roadmap. So it's really the how to do this work. And for any organization that's looking to improve the psychological health and safety in the workplace. It is a strategic framework with methodology for step-by-step evaluation and to achieve the national standard and work towards identifying what you need to address, what programs you need to put in place, and best practice guidelines. But most importantly, it really is, and it is a certification program that also helps recognize those organizations that are adopting the national standard. And that's linked to the recognition through the Canada Awards for Excellence program, which is our national program for recognizing employers who are doing this work at various levels with our standards. And it's once a year going on to its 37th year, which is quite amazing. But more importantly, it really is the framework really provides that blueprint for continuous improvement in that it is progressive in nature. It's a progressive implementation system with evaluation at each of the levels. And this really sustains your focus and enables you to continuously improve. You are constantly refining, you're constantly reassessing and reviewing your programs and monitoring over time. So you're going through a change initiative and you are changing your culture and you're seeing improvement over time. But it is a journey. It doesn't necessarily ever end. It's, as everyone knows out there. Next slide, please. Oh, sorry, just go back the slide. I just wanted to speak of one. Yes, the essence of the framework too is grounded in the drivers. So you can see in the model, there's a leadership planning and programs, process and risk management, and people engagement. And within each of these drivers, the requirements are there, and they span across the organization and down through the organization, looking at management practices and leadership in planning and the other areas that are supporting mental health. So you're constantly looking, you're connecting dots and looking across the organization and then down right through the organization. Next slide, please. So just to touch on the progressive nature of the certification program, we do have 4 levels. Organizations don't have to go through all 4 levels. It really depends on where they are in their own wellness journey and where their starting point is. But the essence of it is that it takes you from building that foundation at the bronze level, which is really important to start off right, get those policies in place, the strategic direction, your alignments, your assessment plans, get those solid in place. And then you move to your developing your strategies and plans. That's the silver level, where you're really looking at a solid methodology and systematic approach. I call this level the bricks and mortar, because it's putting in those structures that will set you for success. And then gold is really looking at effectiveness. So are you monitoring and are you changing your programs as a result of those result of your assessments? And are you refining and changing your goals and your planning and your indicators as you progress through this? So really demonstrating that you are really continuously improving on your plan. And then the platinum level is not the end. It's showing that you are really sustaining what you put in place. You are integrating, you are showing some key trends going in the right direction. And as we all know, it's not a perfect world. So organizations are, side-blinded by things like pandemics and various different things that can happen. So it's really a journey that continues. And after platinum, we call it the order of excellence level, which organizations come back for certification to show that they're sustaining this work and really continuing to improve. And then we provide recommendations for improvement, because there's always areas for improvement. And at each of these levels, there is recognition at Canada Awards for Excellence, the national recognition program that I mentioned earlier. Next slide, please. So why is this important? Why is it important to have a framework, and especially during the times of crises like a pandemic or like COVID? Because of the framework, as you saw, those 4 drivers, they help you really look at management practices across the organization and down through the organization. And it sort of helps you look at the right things. It helps that consistency of focus, because you're evaluating over time and you're reviewing your programs, you're reviewing your plans, and you're constantly looking at how well you are doing and packaging it. And there's a strong focus on employee engagement and communications. So looking at your communications planning and your effectiveness of communications. So you're constantly looking at integrating initiatives and making sure that this is aligned effectively, and then employees understand their role in this work, that it's strategically aligned to a priority, that it's not a program or a project that falls under HR or occupational health and safety or under the wellness program somewhere, that it is a strategically important work, and that people get that. So that's really the essence of the progressive implementation and seeing the culture change over time. So next slide, please. And now we'll go into part 2, and Donna will talk about some of the critical knowledge and skills needed to really address mental health issues at work. And I'll turn it over to you, Donna.
Thank you, Karen. Hi, everybody. Nice to see you, even though I can't see you, to be with you today. And Karen made a really good point that the framework that Excellence Canada provides is what you need to do. And then when, it's boots on the ground, the question is, how do we do that? It can feel overwhelming to leaders and to employees to know exactly what to do and how to do it. So that's what I want to talk about now in part 2. Next slide, please. So the COVID pandemic has triggered skyrocketing mental health concerns, not only, and you know this, not only in employees, but in their families, in the workplace, and in leaders. And all of you who are here today are experiencing mental health challenges. Every single one of us is. We're in a world pandemic, something that we have never gone through in our lifetimes before. And a pandemic can be considered a critical event. So a lot of you in your organizations would have critical event planning. We could not have imagined a pandemic being a critical event. So whatever issues employees were facing or the organization was facing, these have now been propelled into in some cases, dangerous levels in terms of mental health issues. So we need to look at not only, you know, our organizations and our employees, but also ourselves. So today I'm going to identify some of the complexities of managing mental health in the workplace, regardless of a pandemic, and then provide some simple and doable techniques that you can use and take away with you after today's session. My background, I have a master's degree in counseling psychology and have been doing clinical counseling for 25 years. Says over 20, I'll give it away, 25. I've also, for the same amount of time, been doing business consulting that specializes in workplace mental health and psychological safety. And the problem often that happens is you may have clinicians handling mental health issues in their practices. You may have business people who are trying to handle mental health issues at the workplace. And what we really bring together is that marriage of mental health clinical background and the business knowledge and expertise that can really help organizations implement mental health and psychological safety best practices. And I'm also the CEO of Workright Limited with my co-partner, Dr. Stephanie Bott. Next slide, please. So why is there a mental health pandemic in workplaces right now? Next slide. I don't know if you've heard this quote before, but it's really important as a foundational principle. When a flower doesn't bloom, you fix the environment, not the flower. So we have, my husband likes gardening. He bought this tomato plant a couple of weeks ago, and suddenly all of the leaves were starting to wilt. They looked great when we picked it up, and then it started to just do very poorly. And he went online and found that you have to add some calcium to the soil of tomato plants. As soon as he did that, it started to bloom beautifully. And I think we have to really be aware of the environment and the culture that we are creating in our organizations that either cause mental health issues or mitigate against them. And while we can't deal with individuals' mental health issues such as predisposition through genetics or family history or traumatic personal history or whatever the issues might be, what we can do is contribute to employee mental health in terms of what kind of environment we have. And we have a lot of control over that. The workplace environment plays a significant role in this, and I'm going to be talking about it shortly. Next slide, please. So I want to look at some of the individual vulnerabilities that employees bring to the workplace. And when I say employees, I'm talking about all of us. As leaders, we're employees as well. So first of all, we do have a pandemic, which has created a disconnection from colleagues. I would love to be in a live presentation with you today. We used to do this all the time, and now we don't. So there's so much that's lost in terms of that. The next one is really significant, and that is the blurring of boundaries between work and home. We used to go to work, we were at work, even if we worked long hours, and then we came home. We might have gone back online, but we might not have. Now there are no boundaries. And I've talked to people in business meetings who are sitting in their bedrooms. That is not something that we want the workplace invading our personal space. And people do this because they have kids who are using downstairs, you know, the computers downstairs, and they have a partner who's, you know, using some other computer. And the only place they can meet is in their bedroom. And that's just, it is an invasion of our personal space and our boundaries. The other thing is we're all working together at home or schooling at home. And I was talking to someone earlier today, and she said, I can't even get an hour alone. And a person, especially people who are introverts, require downtime and alone time. And I heard a quote once, too much of a good thing is too much. So even though we may enjoy being with our partners and our kids, it can be too much. And if we don't have space or create space and set up boundaries where we can have that space, it just creates more and more problems. So I'd recommend, if you can even coordinate with your partner to, if they can go somewhere, whether it's a walk or take the kids out to a park, which we can do right now, fortunately, and give the other partner time in the home alone and vice versa. It's really crucial. We all know about Zoom and online fatigue. It is getting to be too much for people. In my clinical work, people are reporting that I'm constantly tired. I have no motivation. I could get up and do something, but I don't bother. And it is really just too much. So again, forcing ourselves almost to get away from and create a boundary between ourselves and online work and even online personal interest. If we think that bullying has gone away because of the pandemic and we're not in the same organizational space, we're wrong. In fact, what's happening now is that because employers have to access people through the electronics, they can monitor people, and people are actually feeling that invasion of their personal space. And when we are micromanaged, this creates an environment that is not psychologically safe. So as leaders, we really need to watch our micromanagement and allowing people to still take your time off for lunch. Some people, like, Zoom is just too much, just too much. And so if somebody says, you know what, I have to go out and take a walk after this next meeting, then they need to go out and take a walk. And we have to be okay with being flexible around that. Existential crisis, is this ever going to end? Our world has changed. How is this affecting me? How will it affect other generations? Like, those kinds of questions are coming in on people that, we didn't really have to think about before. We're alienated from our support networks, which is a core support for mental illness. Normally, we would recommend that people be with their friends and their family when they're feeling depressed or anxious. They can't do that. We can't do that. So some of the things that normally we would do to mitigate against mental health issues are impossible right now. We have diminished access to resources and professional services that we may have had. People are terrified that they're going to get exposed to the virus. I was talking to someone the other day, and he said, my age group wasn't affected. We thought, oh, well, if we get coronavirus, we'll be fine. We're young. Our kids it'll be like a quick flu and it'll be done. And now we've got the variant coming in. And so everyone has increased levels of fear and anxiety. Fear about, what if I get sick, if my family gets sick? There's been a lot of relationship clashes and conflict over COVID practices. So not wearing a mask, or wearing a mask when you're walking or not, and going certain places and not going certain places. We really need to suspend our judgment and just focus on what we can do for ourselves, what we believe is right for ourselves and our families, given the protocols that are in place from the professionals in that field. But remember that the relationship needs to be a priority. So, it's easy to get self-righteous or judgmental of other people because they're not following certain practices. And I'm talking about within reason. But we've got to remember that, that relationship isn't worth being broken up over conflict about certain things regarding COVID. Many people have lost their jobs. Many people are afraid of losing their jobs as time goes on. And certainly the isolation, especially if you're living alone, this is particularly hard. And this last wave, people are just saying, like, I can't do this anymore. It's just too much. So there is a real sense of burnout there. Next slide, please. Then all of us bring into the workplace personal challenges and mental health predispositions. We may have had family issues before, and now they've been exacerbated. We might have had financial challenges before, and now those have become worse. Mental health challenges, or challenges of members of our family with mental health issues, illness, and all anyone I talk to, and myself included, it is much more difficult to be motivated to get out and walk or run or do exercise or eat properly or do all of those things that we all know we should do, but we're feeling really demotivated to do those things. There's an increase in addictions, and we can imagine why. It's a coping mechanism for some people, and then this again just creates a cycle of other mental health issues. Levels of resilience. We all come to the workplace with different levels of resilience based on our own history, our personality, our genetics, all those kinds of things. So if we had lower resilience to begin with, let's say we experienced trauma when we were children. So that might bring our level of resilience down, and we go through life with a lower level of resilience. Then we get hit by something like this and the many layers of this, and resilience goes down to a fine line. And so I'm telling you this because we need to be aware that everyone we're dealing with is in a different place in terms of their resilience and their personal challenges. We know this, but it's really important to realize that that we are all in a different place, and to not project how we feel, if we're feeling okay, onto someone else who may not be. And I do want to make a note about mental illness. When we say mental illness, that term in itself sounds a bit like it's pigeonholing someone. We are all human, and we all have mental health challenges. We all experience mental illness. It's just like physical illness. We're all, we've broken an arm, or we get the flu, or whatever that might be. We all get some kind of experience of mental health issue in our lifetimes. And I'll just go back Karen's point about 40 to 50% of people having it. I would say, with the pandemic, I would say most people are now struggling with mental health issues. Next slide, please. So the other contributor to employee mental health, there's the employee themselves, and now there's the workplace environment that I mentioned. So stress related to, and these are some of the points that come up in the standard, workloads. And again, people are actually working 2 to 3 hours more per day since the pandemic started than they were before. And that's again about the blurring of boundaries. So, and also some people say, I might as well do that. I have nothing else to do. But we need to go back to setting those boundaries to create psychological safety and mental health safety for ourselves and for our employees. Ambiguous job responsibilities create a lot of stress for people. We need to, of course, there's flexibility, and things are evolving, but it's really important, especially as this pandemic has gone on, that we again create some boundaries around job responsibilities and don't just start letting them blur, because people are at home, and we don't really know how much they're doing in many cases. Like, they may be doing 10 things and we aren't really aware of that. We think they can just take on this other thing. So it's really important to be checking in and creating those clear job responsibilities. The internal impact of job losses, it's really hard. I have a friend who's in HR, and she says it's just awful having to let people go, and knowing in many cases the circumstances behind the impact of that job loss. Employee conflict does not go away when we're working remotely. In fact, it in many cases increases, because we aren't seeing somebody face to face. So there's something when we see someone face to face and see their reactions and their body language and impact, it can help us understand that person more. We don't have that now. And again, then work conditions and childcare, which we all know what is happening there. Something that is often not recognized to the degree that it needs to be is the impact of harassment and bullying in the workplace. This is probably the biggest contributor to a psychologically unsafe work environment that there is in the workplace. Micromanaging, extreme micromanaging. Now, you may have to get through some tasks or projects or something. Everybody's reporting into everybody else and we're checking in. But when there's a manager or a leader who is micromanaging their employees, this causes distress. It gives a lot of signals to the other person, such as, I don't think you're competent. You aren't working hard enough. You need to prove yourself more. And these things aren't said overtly, but the message of micromanaging is that you do not trust this person. That then tears away at the person's confidence. And then we start into a spiral where they question themselves, then their productivity actually does go down, and it sets a whole chain of events. Now, managers who tend to be controlling become micromanagers. And it's really important to look at yourself as a manager and say, you know what, I'm going to own this. I have a controlling personality. And yet, that sense of control and micromanaging will harm other people. So I need to find a way to manage that need and get my needs met as a manager in terms of information and productivity without demotivating other employees. Microaggressions are the tiniest little things that happen. People are often not aware of them, but they have a huge impact, especially when they happen over time. So a couple of microaggressions might be referring to my business partner experiences this. She's a psychologist and a psychoanalyst. So she has 12 years of training, let alone 25 years of clinical background. And often they don't refer to her as doctor. They refer to her as her first name. Whereas with a male doctor, they will call him doctor something. That's a little microaggression, and we may not realize we're doing it, but it actually diminishes the expertise of that individual. So being very careful to recognize the expertise of individuals in their field. That would be one tiny microaggression. Or, in terms of discrimination, saying things like, all people from Asia are great in math. I'm just making it up. That's actually an aggression. So, and labeling and that kind of thing. Withholding information is a huge act of bullying and harassment if it's done with the intent, or maybe not even the intent, of diminishing the ability of an employee to perform or trying to push them out of the organization. I've been involved in harassment investigations. I've dealt with it clinically. I've consulted with organizations around bullying and harassment. Dr. Bott and I have just put together a whole program to be implemented in organizations to mitigate against bullying and harassment. And so the withholding of information could be considered a microaggression, because a manager could say, I didn't intend to do anything. I'm sorry, I should have invited you to the meeting, but over and over and over again, they don't. Yelling at people, humiliating people, shaming people. Shame is a terrible thing that we would do to others. So and the shaming can take place in many different ways. Boundary violations, again, even in virtual meetings. I've had people report to me that other members of a team would make comments like, I can't believe you didn't get that done again. Like, what's wrong with you? Things like this, and then other comments that are way less overt than that. And then discrimination against those with disabilities, minorities, LGBTQ+, et cetera. And I'm going to talk about the diversity, equity, and inclusion training. And of course, what's happened recently, which has been a good thing, is the Me Too movement and the Black Lives Matter movement, which have elevated the awareness of these challenges. But as Karen said, if we don't have some actual resources and strategies and frameworks for addressing this in a way that actually creates mental health and psychological safety, then that awareness really is not that important. Next slide. What are some of the mental health issues most commonly appearing in the workplace? So again, I want to really emphasize, as that video did, that unless you are a doctor, a doctor in psychology or a medical doctor or a psychiatrist, you cannot diagnose a person with a mental illness. I had an experience with an organization a number of years ago, and the HR leader had taken a course, a couple of courses, self-help courses on mental health. And so she started, quote, diagnosing people. And if somebody came into her office, she would say, oh, you clearly have depression, or, you know, you have PTSD. And then she would share that with other people on the team and say, you know what, you've really got to watch for, you know, support your colleague because they have depression and they have PTSD. That's a microaggression to begin with. It's a violation of confidentiality for another thing, and that's just the beginning. So we have to put this in perspective, and this is where it's a bit tricky for leaders and organizations, because we are faced with the evidence that a person has a mental health issue, but we have no capacity, nor should we, diagnose it or try to treat it. And that's an important point to know. But let's just do an overview of what things you will probably see coming out in the workplace. Anxiety. Anxiety is really happens when events occur that we believe we do not have the capacity to deal with. We may have the capacity, but we don't believe that we have the capacity. So then we become anxious, and different people get anxious about different things. Somebody might be terrified of public speaking and believe they don't have the capacity to speak eloquently or however they want, and therefore they will be anxious. Somebody else who's fine with public speaking won't be anxious at all. So we can't make blanket statements or assumptions about people and their anxiety or depression. We know what depression is. There's a number of markers for depression. Our eating patterns may change, our sleeping patterns may change. We may feel very sad. We might feel that we're hopeless. All of those things can happen. And some people who are high performers can hide that very well for a while. Adjustment issues, that's a huge thing happening now. We're all struggling to figure out, how do I adjust my life to a pandemic and all the restrictions that are in place and the waves that keep coming? How do I continually adjust to that, and having my children at home and having, you know, parents who are sick and all of those things? This is a big thing that we're seeing now as a mental health issue in the workplace. Pretty much everybody has a sense of heightened frustration and irritability right now. Their nerves are pretty frayed because we've been going through this for so long. So again, that irritability, we can watch for that as a sign that, you know, people are under stress. Serious distress from being harassed, bullied, and discriminated against. Reduced resilience to stress. A stress reaction, or the impact of stress, takes place over time. So it accumulates over time, and it's additive, which means that it adds up in the various components of our lives. So I might have a financial struggle. So that's one place in my life. But if I have financial struggles and illness in the family, and I can't see my friends, and then it's become additive. Cumulative means over time. So certainly the pandemic, none of us thought a year from last year this time, we would be in another lockdown. So we now have cumulative and additive stress, which really puts pressure on people emotionally and physically. You know, there's been an increase in relationship challenges, both with other employees and certainly in our home situations. I've mentioned COVID fatigue before. Another thing that's happening is individuals are frequently now demonstrating some of the symptoms of post-traumatic stress disorder. And so now we've added that because we are all really experiencing a trauma right now. We're all trying to adjust to it, but it is a traumatic situation. And that said, I think we need to also be kind to ourselves and realize that, you know, this is just really hard, and we are suffering. Everyone's suffering in some way. There's a great quote from Winston Churchill that I remember reading because people are just going like, I don't know how I'm going to get through this. And he led Britain through the Second World War. And one of his quotes was, when you're going through hell, keep going. And you know, I think of that being paired with the other statement of keep calm and carry on. Like right now, this is often all we can do, but we can do this. And it's causing us also to reach into regions of our own souls and lives and minds and spirits to become better people, to be more resilient than we ever thought we could be, and to be role models of that for our children and our families and our friends and neighbors. Next slide, please. How should workplaces be addressing these concerns? Next slide. So leaders, I've mentioned this before, you don't have to be a counselor. You actually should not be a counselor. What you can do is ask people, observe behavior and focus on that, because that's what we can focus on in a workplace. So we can't ask questions about mental health directly. Are you depressed? Gee, you seem anxious. Do you think you have a trauma response? Don't diagnose, just make observations about an individual's behavior, such as, you know, I've noticed that you have always delivered your presentations on time, and the last couple of weeks you've been late. What's going on? Is there anything I can do to help? So we're literally just observing an action and a behavior in a kind and empathic way and offering to be of assistance. I was talking to a very high performing leader a little while ago, and her boss was saying, you know, you didn't get those reports in, you know, they were supposed to be in. And she went, I've been doing this for 15 years. I know those reports are supposed to be in. I have done those reports on time for those 15 years. I am like an octopus right now. I have my children studying. I have my husband who's ill. I have my parents who are ill. I've got this, I've got that. I don't ask me for these reports. And she said it very respectfully. I will get them in, but I can't perform the way I did before. And to his credit, her boss was apologetic and said, I understand, and you just do what you have to do. I understand. Offering helpful resources and other things. Some organizations have EAP programs that can be referred to, but it's important to know that not all mental health resources are created equal. It's really important that you get resources from clinically trained psychologists and mental health professionals. Right now, with the mental health crisis, everybody's jumping on the bandwagon, and people who have absolutely no expertise or background in this area are starting to tell people what they're supposed to do. And in some cases, these are really dangerous recommendations. I had a situation where a leader told an individual who was in extreme crisis some cognitive behavioral theory that they had read in a book. And they said, just do this, just do this. And what it turned out to be was this person was suicidal. So fortunately, someone found them and got them to the hospital, but we do not have the capacity to deal with this as leaders, and nor should we. So it's really referring out to the best possible resources that you can. Dr. Bott and I developed the Master Certificate Program in the Management of Workplace Mental Health and Psychological Safety for Leaders. And as Karen mentioned, the roadmap tells you what to do. This program tells you exactly how to do it. So step by step, the building blocks of building mental health and psychological safety. There are assessments embedded in it. There are resources, downloadable forms of return to work after a mental injury, helping to understand your boundaries as leaders, scripts on what to say, and ending in an action plan that you can then use to integrate with the Excellence Canada framework that you would have. So that's for leaders. And the second one is a COVID care kit for employees. So Workright have developed over the years about 100 courses in, and they're courses, they're given by doctors and psychologists and doctors in terms of nutrition and wellness. And all of these courses we've brought together, as well as relationship courses and that kind of thing, to offer a COVID care kit for your employees. And I'll just go into that in the next slide, please. Oh, no, I won't. I'll go into the mental health certificate program. We'll quickly go through that. So if you could go to the next slide. And you can find this on our site, training.workright.ca. So it's a 10-part master certificate program developed by leading psychologists and mental health professionals so that you know the information you are getting is clinically sound. The interactive modules explain the many aspects of workplace mental health, and clinicians provide clear guidance on how to optimally address these delicate and complex issues within a work setting, and testing and certification ensures transfer knowledge. And this has been endorsed by Excellence Canada. That is our partnership. And they also provide the certification as part of their roadmap. Next slide, please. You'll find this on our site. This just tells you how we build on a foundation first of understanding and introduction, assessment, and then it builds from there and to our action plan in module 10. Next slide, please. So when we're looking at assisting individuals, we want to, and I'm talking to you as individuals right now, not leaders, just as people. It's really important that we assess our personal areas of vulnerability: physical, cognitive, social, and emotional. And you can just take a second now to think, like, what are my vulnerabilities with physically? I know someone who had a young woman who had a heart attack and a couple of years ago, and COVID and the pressure to, she's a leader, so she has to lead people and do all the rest of it. It's putting a lot of pressure on her physically, let alone in terms of work. That's a physical vulnerability. It may not be that profound, but think about your physical vulnerabilities. Think about your cognitive vulnerabilities. Like, how much are you putting into your brain? I was talking to somebody earlier this week. She said, I literally don't feel I can stuff anything else into my brain. It's just overwhelming. Social, we're all socially vulnerable right now because we can't be with other people. And emotional vulnerability, again, that's something to assess for yourself. And then I strongly encourage you, obtain trusted resources. So if you have extended health coverage for a psychologist or a registered mental health professional, take advantage of that. Workright has many mental health courses, including like parenting and divorce and relationships and navigating illness and all of those things that are, we're having to face today, but we have to face always. Online support groups can be fabulous. Creating that social network, however we do that. Community resources. Check in with your doctor. Like, many people are saying, I'm just so exhausted. And, a really basic question to ask ourselves is, have you had a checkup? Often we get an annual checkup. Have you had that? Have you done blood work lately? Like, these are things that we can do. And it might be as simple as we need more B vitamins or, D vitamins or something, but just check in with your doctor. to see if there's anything else you can do that could be quite simple, as well as our faith communities. That's really important. If we are part of those can give us a lot of support in this difficult time. And COVID care kit for employees. Next slide, please. So in that COVID care kit, we have Managing Depression, 4-part series by Dr. Bott, Managing Anxiety, 3-part series, Stress Resiliency workshop by a social worker who has trained exclusively in stress resilience, Stress Management and Mindfulness by Dr. Newman. He studied with some of the top mindfulness experts in the world. Eating for Life, developed by a nutritionist, Food for Mood. Some of the foods, and I think we all know this, certain foods can help lift our mood. So we can do any little bit that we can do. Managing Addictions by an addiction specialist, Dealing with Difficult People, which is always part of our lives in one way or another. Sleep is really suffering with people right now. Most people I talk to are not getting the, as it says here, the Z's that they need. So there's some good sleep information here. Parenting, things your parents never taught you, which especially, I was talking to someone who just took this course last week, and she said, I knew some of it, or I knew it, but I really needed to hear this again. And it framed it, Dr. Bott framed it in a way that really helped me and kind of got me back on track, because everything has been so crazy. Relationship roadblocks and how to repair them. Relationships, as we know, with our partners or friends can be suffering, and this is a good guide. And another Stress Management 3-part series as well. So all of that's available for actually $19.95 per person, which makes it really accessible for your employees and is a benefit, a trusted benefit that you can provide for them. And we're doing that in relationship with Excellence Canada. So you can go on their site and see that there. Next slide. The next thing is diversity, sensitivity, and inclusion training. Now, we're all pretty much aware of this right now, but it's important to remember this is part of a psychologically safe workplace. And it really falls under the umbrella of harassment and bullying, because that's how it's experienced. If we are not treating people with respect, then they are feeling diminished and harmed. And when we're not treating people with respect, then there's a very good chance we are harming them. It doesn't help them, it doesn't help us, and it doesn't help the workplace. So we're also offering this in partnership with Excellence Canada. So again, you can go on their site to get this training course. Next slide, please. So we're at the end of our formal presentation. There's so much more I could say. I hope you're still all awake there. So I think I'll bring Karen back in to moderate this part of the webinar. Thank you so much.
Thank you, Donna. That was really enlightening, and you really deep dived into some of those individual risk factors and the workplace risk factors. So that was very helpful. We do have a question. So we have time for questions. If anyone has a question, please put it into that question and answer box. We did have one question around emotional vulnerability. If you could expand a little bit more about this, Donna, from your perspective.
So we become emotionally vulnerable. Again, there are factors that contribute to emotional vulnerability. One of the biggest ones that we have control over in the workplace is bullying. So I cannot tell you, over the years, probably easily 100 high-performing business professionals who were brought to their knees by bullying and harassment. They went from having no pre-existing mental health conditions whatsoever to literally not being able to get out of bed and thinking they were going crazy because of the mental manipulation that was happening through bullying and harassment. So, regardless of your resiliency, it is a highly negatively impactful situation on emotional health. There are the personal factors. So that would be your biggest workplace impact. And it's catastrophic, actually. The next one, I would say, in terms of individual, that can fluctuate from time to time. So if you've just had a significant loss, especially in COVID, you've lost a parent or you've lost a loved one, and it's hard enough to go through that. And then if you couldn't see them or be with them, it's horrible. And so that's going to bring down our emotional capacity, not forever necessarily, but for a while. Again, not caring for ourselves in terms of what we need, listening to our own bodies and minds. I've worked with many people who've had a traumatic background, and they learned as children to not acknowledge their own feelings because nobody else did. They had to just suck it up and take it and keep going. And they can actually be very high performing adults. But what they lose is the ability to touch in with themselves and go, you know what, I'm really tired. I just need to sleep. Or I need to take a couple of days off. Or I really need to be eating better. They disregard that. So that puts us at risk if we aren't checking in with ourselves, especially now in terms of what we need to take care of ourselves.
So important. Thank you. Another question. So someone working with nurses and struggling with what would be considered mental health and emotional literacy, and they're shying away from self-assessments or assessments in terms of their mental health. And so just, I guess the question is really around what would mental health, emotional literacy for nurses. And do you have any comments on that?
I would love to ask the person a couple more questions to just understand this a bit more. Certainly as nurses, you have extraordinary things coming at you. At the best of times you do, and you are extraordinary. I just want to say that. I know a couple of nurses, you're extraordinary people. What I think I'm getting from the question is that you're moving away from assessing other people's mental conditions or how they are in their workplace situations, and what do you do? I don't know if that's what it is. What I could say, I guess, is again, we can look at behaviors and just see like how people have changed. And one thing we do know is that people will flip styles. So if a person is normally pretty hyper and pretty, dramatic, and then they start becoming withdrawn and non-interactive, something is going on. And the opposite, if somebody's pretty quiet and withdrawn and suddenly they're exploding or they're getting angry or whatever, we know something's going on. So again, we can always bring it back to behavior, and then we can just ask questions to understand, like, I've noticed that, is everything okay? The difficulty is you're afraid as well, right? You're dealing with so much too, and it's hard sometimes to be empathic when we're on, so stretched ourselves. So it's really, giving, observing, and giving what we can and supporting where we can.
Great.
And if you have, a side question, then, please, I'm sure I could get that information. I'd be happy to talk more. The other thing is our mental health certificate program actually goes through all of that. So when you can't do those kinds of assessments, the course will show you how to do that.
Great. You might be able to check with her offline on this, more on this question.
Yeah.
One last question. We have 2 minutes. If an employee has anxiety and is not producing is not producing at the level that they should be, any tips for discussing with this employee without causing more anxiety?
Yeah, that is a fantastic question. And it goes back to this simple formula of observing the behavior. We can, as leaders, manage performance. That's what we can do. So you want to make it a performance issue in a kind and empathic way. So again, you'd also want to take into account the history of the person. Has there been a history of, and there's so many options here. Has there been a history of not performing due to anxiety? Or is this new? So, I mean, we need to think about that. But if it's new, either way, we can't say that it's anxiety. What we can say, and if the person discloses that, then you're more able to talk about it. But really, we can't do anything. You're not a clinician. You have to move it into the performance field and say the same thing. I've noticed, like, over the last 3 months, and especially since COVID, that you seem really distracted, or whatever you're observing, some of those anxiety behaviors, whatever you're observing. And I want to be understanding of this. The problem is, and we want to identify an impact when we're doing that. So the problem is that now other people are falling behind because you haven't been able to deliver this. So I want to work with you, acknowledging that this is stressful for you, but also acknowledging that we have to also support everybody else to meet these deadlines, or whatever it might be. And so that would probably be the best way to do it. And again, I give a lot of scripts in the training program, but generally you're safe doing it that way.
Great. Okay, we're at our time, unfortunately. I know there's more questions, and we'll follow up with these questions offline and connect with the people after. So appreciate everyone for attending today's session. As I said, the resources are available in the presentation. We'll be sending the recording out to everybody, and you'll have a copy of the slide decks with that to follow up on. And of course, you can contact us. Our contact information's in here as well for any further questions. So thank you, everybody, for attending, and enjoy the rest of the week.
Yes, thank you so much.
Thank you, Donna.